Welcome to today's Explainer. We're diving straight into some truly fascinating, life-saving science today. We're looking at exactly how specialized amino acids are being used to repair muscle in patients with chronic kidney disease. It's this brilliant intersection of biology, nutrition, and clinical medicine, and I can't wait to get into it with you.
So, let's start with a seemingly impossible catch-22 that kidney patients face literally every single day. Look, we all know our bodies need protein to maintain and build muscle mass, right? But what on earth do you do when the very organ responsible for filtering the byproducts of that protein is failing?
To unpack this medical marvel, we've set up a clear roadmap for this explainer. We'll start with the kidney patient muscle crisis, meet our muscle repair heroes, tackle the 1,500 kilocalorie rule, look at intravenous administration, and wrap up with some crucial safety rules.
All right, Part 1, the kidney patient muscle crisis.
Imagine a delicate scale inside your body. Now, in a healthy person, muscle synthesis and degradation are perfectly balanced, but for a chronic kidney disease patient, it's a whole different story. The causes of muscle loss are incredibly complex here. You've got chronic low-grade inflammation, insulin resistance, and metabolic acidosis all teaming up. Together, they increase protein degradation and decrease protein synthesis. This completely tips the scales toward a negative protein balance, leading to a really dangerous loss of muscle mass, which we call sarcopenia.
So, to stop this muscle wasting, you'd intuitively think, well, just eat more protein, right? But here is that catch-22 we mentioned. Digesting normal dietary protein, like a piece of chicken or a glass of milk, produces toxic nitrogen waste, including urea, and failing kidneys simply cannot filter these toxins out of the blood. So if a patient eats too much normal protein, these toxins build up and actually accelerate the progression of their kidney disease. It's a really tough spot to be in.
This brings us to Part 2, our muscle repair heroes, amino acid therapy.
This is where specially formulated therapies step in. They are packed with essential branch-chain amino acids, or BCAAs, like L-leucine, L-valine, and L-isoleucine. These act as direct triggers to literally stop muscle breakdown in its tracks and promote new muscle synthesis. But here is the absolute magic of how these amino acids work to repair body muscle. Instead of creating new nitrogen waste, these essential amino acids actually recycle the toxic urea nitrogen that's already circulating in the patient's blood, and they use it to biosynthesize non-essential amino acids. They're literally cleaning up the body's waste while building muscle at the same time. How cool is that?
So the crucial takeaway here is that, unlike traditional dietary protein, these specialized amino acid formulations provide pure, clean building blocks for the muscles. Clinical studies actually show they successfully decrease blood urea nitrogen levels, increase total protein and albumin in the blood, and ultimately delay the progression of the kidney disease itself. It's basically a targeted strike against malnutrition without any of the toxic collateral damage. The benefits of this amino acid therapy are just profound.
Moving on to Part 3, the 1,500 calorie rule.
Listen, if there is one single thing you take away from this entire explainer today, it needs to be this massive, incredibly important number, 1,500. It is absolutely crucial for making this therapy work.
To understand why this number is vital for absorption, think of these specialized amino acids as a massive pile of premium, high-quality bricks dropped off at a construction site to build a house. If you don't provide the workers with enough energy to actually lay those bricks, well, nothing gets built. The bricks just sit there. In the human body, non-protein calories are the worker's energy. If a patient doesn't consume enough energy, specifically providing over 1,500 kilocalories a day, those amino acid bricks cannot be absorbed or utilized to build muscle. Giving energy over 1,500 kilocalories literally helps the absorption, period.
In fact, the official clinical guidelines for these therapies are incredibly strict about this. Providing more than 1,500 kilocalories per day is highly recommended to ensure the efficiency of amino acid absorption and utilization. Without this adequate energy supply, not only does the therapy fail to build muscle, but it can actually backfire. It could potentially worsen the patient's metabolic acidosis or increase azotemia, which is exactly the condition we're trying to prevent in the first place.
All right, let's look at Part 4, intravenous administration. The clinical protocol here must be followed meticulously, step by step. When administered through a peripheral vein, a standard 200 milliliter dose must be given very slowly via the intravenous route. We're talking over the course of 120 to 180 minutes. For patients who are undergoing hemodialysis, the timing is specifically calibrated.
The amino acids are injected into the venous side of the dialysis circuit about 60 to 90 minutes before the session ends. This ensures the nutrients aren't just immediately washed out by the machine.
Now, you might be wondering, why does administering this so slowly via IV matter so much? Well, rushing an IV drip through a peripheral vein is incredibly dangerous. A rapid flush can cause severe vascular pain right at the injection site, phlebitis, chest discomfort, palpitations, and even cardiovascular overload. The body absolutely needs time to safely integrate these concentrated nutrients, so giving the medication slowly through the vein is a non-negotiable rule.
And finally, Part 5. Safety must come first.
We really have to emphatically highlight that while these therapies are absolute game changers and life-saving for many, they do require rigorous medical supervision. They're altering the fundamental nitrogen balance of the human body, and because of that, they just aren't safe for everyone.
Doctors have to constantly monitor patients for complications, especially those with liver issues. In fact, this therapy is strictly contraindicated for patients with severe hepatic function disorders or hepatic coma. On top of that, if these amino acids are used as the sole source of nitrogen, there's a serious risk of hyperammonemia, which is basically an excess of ammonia in the blood. Medical staff have to watch for clinical signs like a hawk. If a patient suddenly shows a slow response to a voice, or maybe a decrease in spontaneous speech, the drip has to be stopped immediately. These safety protocols are completely non-negotiable.
So I'll leave you with this provocative thought. Clinical studies are already showing that combining this essential amino acid supplementation with structured exercise yields absolutely incredible results for fighting sarcopenia. As we master this precise science of fueling the body without taxing failing kidneys, what incredible new frontiers might open up for elderly patients? Could we literally rewrite the timeline of physical decline and chronic illness?